The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hi, everybody. Welcome back to APIC's The 5-Second Rule. Today we're going to talk about there's no place like home health. That's right. We're going to talk about infection prevention and control issues when you are getting care at home. I'm your host, Silvia Quevedo, and I'm joined today by Victoria Adams. Hi, Victoria.
Hi, Silvia.
So let me tell our audience a little bit about you, Victoria. You are the Associate Director and Infection Preventionist at the Visiting Nurses Services of New York, which apparently is one of the largest home care organizations in the entire U.S. You are a family nurse practitioner and a public health nurse, and you have interest in doing research in the home health care setting. Did I get that right?
That's correct, Silvia.
Well, welcome. All right, let me just, I have some numbers because, it's always good to have numbers. People like that. You actually are published, Victoria, and I'm getting some numbers from an article from the American Journal of Infection Control. And by the way, this is, I'm going to give you the exact issue. It's the American Journal of Infection Control, Volume 49, Issue 6, and it is Infection Prevention and Control Practices in the Home Environment, Examining Enablers and Barriers to Adherence Among Home Healthcare Nurses. Basically, an article outlining what are some of the challenges to do home health infection prevention and control. But what is in this article that I think is interesting in terms of numbers is you and the other authors indicate that from 2002 to 2018 in the United States, the number of home healthcare users increased by 35%. And that really looks like in 2018, 3.4 million people were visited by a home healthcare provider. And it also said that those visits were from over 11,000 agencies. That's a lot, Victoria.
Yes, Sylvia. So home health care need and popularity has been growing lately. We do have an aging population, and majority of people want to age at home or age in place. Skilled nurses, therapists, personal care workers, and social workers, they deliver services to patients who may not be able to easily leave their homes to receive these services in the hospital setting or outpatient setting. And this trend has been growing for us.
Yeah, well, let me just say that I'm aging at home. So, okay. So an aging population and a large number of those individuals are receiving services because they can't get those same services in the home. Let me ask you, Victoria, because just for our listeners who are not just APIC members who are infection preventionists, but I know back in my former clinical life as a therapist, you would start out in the hospital with, a terrible episode, whether it's a stroke, heart disease, an operation. You might end up going to rehabilitation, and then eventually, your care or your rehab tapers off a bit. So you end up at home, and then people come to you. That was in my world in neuro rehab. But talk to me a little bit about the types of diseases or the types of care that these individuals are receiving in home health.
There is a recent trend of earlier hospital discharges and also the delivery of complex procedures outside of the hospital setting. People prefer to receive home health care at home, and the complexity of the services they receive has significantly increased. Also, with advances in technology, many procedures can now be delivered in the patients' homes, where they could get chest X-rays, they could get infusion services provided to them at home. With all this complexity and increase of use of home healthcare services, the quality of care has been very important.
Okay, so yeah, I mean, that makes sense. With technology advances, obviously there's a lot that can be done. I mean, nowadays, you wear a watch and it tells you all kinds of things. So you're home, but there are people that, for example, what are the common treatments? I'm thinking wound care, people who need IVs. Those make up a good number, or am I just making that up, Victoria?
Oh, yes, definitely. I would say that between 30 and 60% of recipients of home health care have wounds.
Well, let me ask you this, Victoria. In your experience, just in your work with, as a nurse and what you're seeing in terms of your research, because again, I mentioned you are primary author on an AGIC article that looks at some of the barriers and challenges with infection prevention and control in the home. So just, what are they? What are the challenges? And more importantly, I think for the APIC members, what is the role of the infection preventionist in home health? Who are they really? Who is their audience? Is it the healthcare provider? Is it the patient? Is it the patient's family, or all of the above?
Oh, okay, that's a great question. So my role as an infection preventionist is to support the home healthcare providers while also promoting the quality and safety of the overall home healthcare patients are receiving. So while I'm working with home healthcare providers are working with patients, their families, caregivers, or household members.
Okay, so you're sort of training that healthcare worker on what they need to be doing. So I can kind of guess what the challenge would be if you came into my place, but what are some things that are a challenge for the nurse or the therapist walking into someone's home that make infections risky?
So there are several challenges that are quite unique for infection preventionists in home healthcare setting. And like you mentioned, there is a great variability in people's homes. So we all have different homes and our unique ways of living. So,
I
in home
think you're
health
being
care,
polite, right? Are you being polite about how clean people's homes are?
I'm just being realistic. So we all choose different ways to live, and also sometimes this is not even a choice. If, for example, a person becomes disabled, then they do not have the capacity or ability to remove the furniture or to remove the rugs or even clutter. Coming from the hospital after a traumatic event, maybe after a hip fracture or a fall, a person is faced with these new challenges that they do not know how to deal with. And the role of home health care provider in this situation, that would be a therapist or maybe a nurse, or maybe a personal care aide, is to help the person to achieve the best level of their functioning. So there is a big variability in the environment, in the homes of the patients. And the challenge for infection prevention in home health care is that a person's home becomes the workplace for a home health care provider. So while there are many challenges for IPs in other settings, in home health care, the provider also has to overcome the challenges of the environment.
So furniture, clutter,
Yes.
pets.
Yes. Even, let's say, access to running water.
Oh,
So,
wow, really?
yes, yes. So, some of the home healthcare providers reported that the patients may not have running water for various reasons, and they have to be
Wow.
prepared to overcome these challenges that may not be encountered in other settings.
Okay, so that's fascinating. Now that you say it, it probably makes sense depending on different communities that you're going into, but that's a whole other podcast and discussion about not having running water. So I like what you said about a person's home becomes the workplace. I think that that's key for people to understand. So tons of challenges. It's not a controlled environment. What else? You go in and hi, Mr. So and so, I need to put in an IV or check your IV. What are some other challenges that you've discovered in your research and in your work?
Home healthcare providers, they need to be prepared for any situation that they may encounter, and therefore they need to carry all the infection prevention supplies with them that may be needed during the provision of care. So in a situation where there is no running water, then it's imperative that providers have sufficient supply of hand sanitizer with them. Also, maybe the unpredictability of the care and services that need to be delivered. A nurse or a therapist may see the patient with a plan to perform the services, but then they encounter another challenge. For example, a nurse is preparing to see the patient for a wound care and discovers that the patient also has a catheter. And now the nurse would have to be prepared to either remove or change the catheter and have the adequate supplies with her.
Okay, that's that's an excellent point. But I'm going to challenge a little bit, and maybe this is a question about the administration of home health. Because you're right, you never know what you're going to walk into, right? Who's in the house, the pets, the kids, the extended family, the cleanliness, the supplies. All of those are excellent points. So if you're a home health provider listening or an infection preventionist, take notes. But you said that the provider may, I think in your example, be working on hey, I've got this patient, I'm going to be dealing with their wound and providing wound care. Oh, look, they have a catheter. My first thought is, why didn't they not know that? So help me understand what kind of information that provider has and where they're getting it. I think I mentioned something like 11,000 providers of home health care, and what the IP needs to know about that. Because that seems, I'm just going to say it, Victoria, wrong. Shouldn't you know everything going on with that patient as a home health provider?
Yes, definitely. The providers are getting the information beforehand that is being provided by other settings. And if there is a situation where this information is not available, let me give you an example. A doctor, a nurse practitioner, maybe PA, is giving a referral for home healthcare services on a specific patient, for home healthcare nurse to check and do the assessment because this patient did not come for a visit. So then the healthcare provider may not know the recent medical history of the patient or what happened recently. Maybe the patient had unplanned hospitalization and now has a new condition that the provider has not seen the patient and does not know about this condition. And the home health care provider who is going to see the patient in the community in their home may discover the new conditions and new information that was not known to the referring provider to begin with.
Okay, gotcha. All right. We'll let them off the hook there. Okay, good point. So again, I think what you're saying is you just don't know what you're going to step into, and you have to be prepared for pretty much anything. It sounds like, IPs and providers need to be sort of the MacGyvers of, and have everything at the ready. So what, in your experience and in your research, are, the breakdowns in infection prevention and control with those providers? Is it about supplies or what else? Do they not know they have to wash their hands? Do they not have PPE, personal protective equipment? What in your experience are the challenges that and it's important to know so that we can remedy the problem, right?
The challenges may come from the home environment itself. For example, if the provider is arriving to patient's home, finds that there is not sufficient space or no sufficient lighting to provide the wound care, or if there are children who need caregivers' attention, or there are pets that need to be taken care of.
Okay, so children, pets. What about supplies? You said that the providers may not have adequate supplies. Who typically provides that? The agency?
Yes, so the agency provides all the supplies that is required for the care of the patient. And it is the responsibility of the home healthcare provider to prepare every day for the visit and carry sufficient amount of supplies based on the care that the home healthcare provider is anticipating to provide. So if the provider has to be prepared, and then due to various events that could have happened during the day or unpredictable situations, then the provider would actually have to return to the office to get additional supplies. So it's a lot of planning that the home healthcare provider would need to do. If, for example, the supplies are malfunctioning, right? It's a very rare circumstance, but the home healthcare provider would have to have extra supplies. Or if the supply was dropped, then it's another supply would need to be used. Or if the patient has developed a condition or a new wound, then the home healthcare provider would have to provide extra wound care for the patient and have additional supplies. Or maybe the supplies that were ordered and the patient may have from a different setting may not be appropriate based on the assessment of the provider.
Victoria, talk to me about, what you do as an infection preventionist for the visiting nurses services. Just tell me a day in the life of Victoria as far as your IP work and who you interact with and why you chose home health. It's always fun to hear why that area.
So home health has been my interest for a very long time. So Visiting Nurse Service of New York is 28 years old. Yeah,
Wow.
it has been founded by Leda and Walt with the new immigrants coming to the United States and living in the settlement. And the home healthcare nurses were actually making visits to the homes of the immigrants that lived in those settlements.
Oh, I didn't know that.
Yes, and there is a Henry Street Settlement Museum. And I remember,
I've actually been there. The tenements, right?
yes,
Is
the
that what you're
tenement.
talking about?
Yes,
Yeah, I've
yes.
actually been there. They're fascinating. So that's interesting. That's how at least visiting nurses started in New York.
Yes, that's correct.
Wow. See the facts you learn here on the 5-second rule. Okay, so that sort of spoke to you. And what's a day in the life for you as an infection preventionist working in that space? What does that look like? You get up in the morning, you have your coffee, then what?
Yes, after having lots of coffee. So I collaborate with multiple departments and multiple people to support the home healthcare providers who are actually making visits to patients' homes. I provide sort of consultation type services for any questions or any urgent situations related to infection prevention and control that home healthcare providers may encounter.
And so do they call you? Are you answering emails? What does that look like?
Yeah, so I answer a lot of emails and also have a lot of phone calls and meetings. Home healthcare providers are working independently and they are going from home to home of the patient, and they have to do the assessments and provide the services without any of the support physical support in the home. And so they are being supported by the managers who are just a phone call away. So the managers are supporting the home healthcare providers that are in patients' homes. And home healthcare providers could call me, or they could call their managers, so that they would have a collaborative action plan or a discussion what needs to be done in that particular situation.
So, Victoria, let me ask you, is the model you just described typical for an infection preventionist in home health?
This model may not be typical, because the role of infection preventionist in home health has been done by educators, or maybe compliance.
Got it.
Or director of nursing, if this is a smaller home healthcare agency.
Okay, that makes sense. So you're answering emails, you're getting phone calls. Do you ever actually shadow or go with the clinician into the home?
So I do conduct the observation visits, and I also conduct the training for the providers as well. So I'm also working on policies and procedures related to infection prevention and control, and to evaluate how these policies and procedures are working in specific environments or specific patient population. I would need to speak to the providers using these policies and procedures. So to have a formal process to do that, we actually have Infection Prevention and Control Committee that I chair, and this is a multidisciplinary collaborative process where the providers, the managers, the educators get together and review the information that I'm usually providing as far as data on the infection or any infection prevention and control issues or challenges that may have happened.
Okay. So let me ask you another question. What in your and again, you don't, just top of mind, what are common questions that come in around infection prevention and control? Like top two that you hear, like, oh, that's another one. I heard that yesterday. What are the top two? According to you, we won't hold your, feet to the fire on this, but just in your experience.
Common questions I've encountered were about the precautions to be used in the home. So the providers are asking whether the patients need the precautions at this particular time, or maybe the precautions would need to be discontinued.
Okay, and so just for our listeners, we're talking about contact precautions, right?
Yes.
Standard contact, respiratory.
That's correct. Yes. So,
okay. So they're saying, does the patient still need to be on it? That's a big question. Okay, that's good. What's another one?
Another would be related to the personal protective equipment. So that's another one that is quite common.
So with the personal protective equipment, is it the provider saying, what do I need to use? Or does the patient still need to wear?
All of our home healthcare providers are using the standard or universal PPE when they are making visits that are required for all encounters with patients. But the questions may arise about the patients and, let's say, their caregivers how could they use the personal protective equipment.
Got it.
Yeah.
Okay. Well, that's helpful, Let me ask you, Victoria, I'm going to ask this. Okay. What's the craziest thing you ever saw walking into someone's house or that you heard of someone walking?
I think that I would call it like a scary thing. Bed bugs is a scary thing for a lot of home healthcare providers.
Yeah.
Yes.
Yikes. Ugh. Okay. Yeah. Bed bugs. We get that question a lot here at APIC too. It's not a healthcare associated infection, but it can spread. Well, let me ask you this, Victoria. What would you say to an infection preventionist listening that maybe isn't in home health, right? Maybe this is an area that they're thinking about, or their employer might add home health as a service. Where do you see the knowledge gap, or what do all IPs need to really understand around the challenges of home infection prevention and control in home health? Mm-hmm. What would be your message to them?
Mm-hmm. My message would be to actually study the environment, the home healthcare environment. It's extremely interesting. Because of this variability in the environment, but also the answers or let's say the solutions that were already established and used in a more controlled environment, they may not apply in home healthcare per se. So therefore studying the patient populations and the unique environments of the homes would help the IP to develop the skills and maybe adapt the standardized procedures to home healthcare setting.
Okay, that's good advice. I think we're hearing that as well in other settings like long-term care, where it is about adapting those fundamentals of infection prevention and control to fit that space, and showing some flexibility and adaptability and working collaboratively, which sounds like all the things you're doing. So you heard it here, everyone. I coined the term MacGyver for anyone who remembers that, but you really have to turn yourself into a MacGyver infection preventionist in the home. I want to thank you very much for your time and expertise, Victoria. And again, everyone, please be sure to check out www.apic.org. And for those of you who are interested in boning up on some of your research articles, definitely check out the American Journal of Infection Control at agicjournal.org. Thank you.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphen.